This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
If you're dealing with gut issues, you're not alone. 1 in 10 people worldwide are dealing with a disorder called irritable bowel syndrome, or IBS.
I was just under the assumption that I just had bad stomach cramps.
Those living with it experience abdominal pain, bloating, constipation, diarrhea, and other bowel habits that are not considered polite public conversations. But it causes so many to suffer in silence and can cause a significant disruption in everyday life.
IBS is actually the second most common reason for missed work or school.
Plus, we'll look at ways to get more fiber into your diet and keep your digestive tract clean.
Fiber doesn't have to be roughage. Fiber is actually sort of pretty delicious.
It can be delicious.
We're taking a gut check straight ahead on Prescription for Life. Hi, and thank you for joining us. I'm Monica Robbins. Let's face it, talking about your bowel movements can be embarrassing. Well, this episode will shed light on a topic many people may not be aware of and let sufferers know they're not alone and help is available. Experts estimate that only about 5 to 7% of people suffering from IBS see a doctor and receive a diagnosis. And when it comes to a diagnosis, women are suffering the most, twice as likely to get diagnosed than men. But there is good news. Most people can manage the disease by making some lifestyle changes. We'll get to that with our expert in just a minute. But first, this story of 2 women suffering, one from IBS and another woman has IBD, or inflammatory bowel disease. Both are helping others cope. Frank Wiley with our Tampa Bay station shares their story.
Comfort and company, community built through hard times.
I'm passionate about helping those who can't fight for themselves.
Stephanie A. Wynn testifies, and the room listens to every detail.
Vomiting, diarrhea, at the same time. So if you got that going at the same time, you can't function.
Stephanie has inflammatory bowel disease, or IBD.
I'm doing good. I'm doing much better. I've had 2 hospitalizations over the summer.
Issues: chronic inflammation of the gastrointestinal tract. According to the CDC, Black people are impacted at a higher rate.
So our goal is to bridge the gap between the patient and the provider so that they understand how to communicate.
She calls these crowds lunch and learn sessions. Every month, Stephanie invites the public to swap stories and solutions.
I was just under the assumption that I just had bad stomach cramps.
Turns out, Lolita-Pitts has something called irritable bowel syndrome, or IBS.
But I also was told that it can turn into IBD and or cancer.
Today, Lolita tells anyone who will listen what to watch and how. She shows up at Lunch and Learn, too. Meantime, Stephanie passes all her resources to the crowd.
And that includes like a gastroenterologist, an IBD specialist, a dietitian and nutritionist, a mental health counselor.
Access through self-help, ultimately worshiped relief.
You ever think your stomach was going to help you find your caller?
No, but the Lord works in mysterious ways. We never know how he's going to use us and what he uses to use us.
Now to our expert who sorts out IBS and how you can find relief. Joining me now is Dr. Anthony Lembo, a Cleveland Clinic gastroenterologist. Thank you so much for being here.
Monica, thank you for having me. This is an important topic, so I'm excited to talk about it.
All right, let's start with what is IBS?
So IBS is a chronic condition that affects somewhere between 4 and 10% of the population. And it consists of a number of different symptoms. Abdominal pain, which is the key symptom associated with IBS, typically in the left lower abdomen, but it could be anywhere, and it's associated with a change in bowel habits, constipation, diarrhea, and some people go back and forth between diarrhea and constipation. Bloating is also another common symptom associated with IBS. So this constellation of symptoms is what makes up IBS.
How do you know it's something like this compared to just an upset stomach or you ate something wrong?
So we all experience that. I mean, every one of us gets upset stomach, diarrhea, constipation. The difference is those are intermittent. They occur rarely. IBS is a chronic condition, so typically lasts for years for many people. So it comes and goes, maybe not every day, usually intermittent, but it's pretty consistent, and it's not always associated with a typical type of food. It's just something that occurs within their body, so they're experiencing it very frequently.
So how long should you be noticing it before you need to go see a gastroenterologist?
So generally, it's a rule of thumb about 3 months if you're having chronic symptoms, but it also depends. If you're having other type of symptoms, including like rectal bleeding or blood in the stools, or vomiting, fevers, chills, those type of things, then probably sooner. But if it's just the intermittent cramps and abdominal pain, maybe just wait and see what happens with it.
So we heard a lot about IBD, but what's the difference between IBD and IBS, or is there a difference?
Yeah, they're different entities, so different disease states. Inflammatory bowel disease, or IBD, is an inflammatory condition. So it consists of inflammation in the lining of the GI tract, and it's either broken down into ulcerative colitis or Crohn's disease, depending on the location, the type of inflammation. IBS is associated with changes in the immune function, but it's not an inflammatory condition that we can see when we do an exam of the colon, for example. So they are very different, and the treatments are very different. One is focused on anti-inflammatories, and we can talk about the treatments associated with IBS. Now, inflammatory bowel disease, what's confusing to some people is that people with inflammatory bowel disease can develop IBS-type symptoms. So once their inflammation is under good control, they may often have a lot of the symptoms that mimic IBS or similar to IBS. And that has to do with a similar pathophysiology where there's inflammation that triggers the nerve endings within the GI tract, similar to what happens in IBS, and then that causes those type of symptoms. And sometimes the treatments can overlap once the inflammation in IBD is under control.
So what's the treatment for IBS, which sounds like the more minor of the problems, right?
Well, it's not minor in the sense that it can impact someone's quality of life. So we've already spoken how common IBS is. It affects somewhere between 4 and 10% of the population will have the symptoms that we mentioned about IBS. And for many of those people, it's associated with a reduction in the quality of life. IBS is actually the second most common reason for missed work or school, and second only to the common cold. So it has an enormous impact on quality of life as well as economic impact on individuals. And not only that, there's people that have IBS that seek health care obviously use more health care dollars associated with it. So the treatment, so it is an important disease to think about and to recognize for physicians and for patients. The treatment initially is improving lifestyle factors, because we know that those can contribute to IBS. And those can include things like improving your sleep, which I know you did a wonderful segment on sleep recently, and sleep has been shown to be associated with, worse sleep has been associated with IBS. Improving sleep can also improve gut function, among other factors. Our diet is incredibly important. There's lots of evidence to suggest that more unprocessed foods that you eat, the more healthier it is. So people with really eating lots of high processed foods tend to have more IBS symptoms. So we know that, and that can affect the microbiome or the bacteria and the other organisms that live inside our gut, some of which are healthy for us and really can improve our overall health, including IBS. Exercise, not smoking, drinking no more than a moderate amount of alcohol are all factors that can improve IBS. So we start there with patients. We don't go straight to a medication. We say, let's improve the health, your lifestyle. Reducing stress is probably the other thing that we try to help people with, because stress can affect the GI tract in all of us. In people that have IBS, where the nerve endings are sensitized, we know that those patients can have more symptoms.
So, let's go back to diet, because I think a lot of people are very interested. Are there any foods, aside from don't eat processed food, which is great advice for everyone, but are there any foods that trigger it?
So there's no specific food that will trigger IBS. Things can make it worse. So for example, if you have more frequent stools, then drinking coffee, a stimulant, can increase bowel function. Smoking, of course, can increase bowel function. That can make it worse. And again, we don't recommend smoking. Some of those foods can trigger it. We do recommend soluble fiber. So fiber is things in our diet that we don't digest. And those are things that, some of which the bacteria in our colon do digest. And again, some of those bacteria are very healthy. Their byproduct, there's actually what the lining of the GI tract lives off of. And so it can be extremely important. We absorb some of those short chain fatty acids, which again can be helpful. So soluble fibers can help people with it. There's a whole diet associated with that has been shown to improve IBS, and those are called FODMAPs, low FODMAP diet, and it stands for fermentable oligo mono and polyols. So these are the type of sugars that are not well digested. That's just an acronym that's used. So there's sugars that are not well absorbed by our GI tract. And those go into the colon that are digested by the bacteria, and they can cause an increase in symptoms. So once we do the healthy lifestyle diet, then we talk to patients in detail and try to find out if there's an actual trigger within their diet. So rather than start a really complex diet, I'll inquire what they eat on a regular basis. Common things like your artificial sugars that are found in many of the diet sodas, etc. Those can trigger IBS symptoms. So we try to avoid those. Some people are very sensitive to dairy. They may be either lactose intolerant or they may have other sugar intolerances like fructose intolerance, et cetera. And if we find out that someone's drinking a lot of dairy products or taking a lot of fructose products, we'll start by avoiding those type of foods. So it varies from person to person, which is what makes it so difficult for all of us to really identify specific foods. Some people are lucky and can say, oh, I know I'm lactose intolerant. Others are not so lucky because it can be our food is so complex. So this low FODMAP diet would be the next thing that we go to in many of our patients. It's very complex, often recommended to be done with a dietitian, although there are lots of resources for patients on the web. Many of them are free and they can give good advice about it. And again, avoiding those type of sugars can sometimes help people. And what you do is you limit it for a short period of time, 2 to 4 weeks, and then you reintroduce the foods and over time to see if you can identify the specific ones that are causing symptoms.
So you mentioned fiber. A lot of people are, they don't have time. So what about taking probiotics, and what about taking like soluble fiber, like the products you can buy at the store?
Right. So we emphasize dietary fiber first, right? And when people are unable to do that, or as you said, because of convenience, et cetera, then we may do a commercially available fibers. And there are a number of them are widely available. Probably the most common and the best studied is psyllium. And psyllium is a natural product that is a good soluble fiber, and it has the benefit of being a non-fermentable soluble fiber. So it does tend to stay in the GI tract. And it forms kind of a gel, and it helps to improve stool consistency. So it's actually a pretty good fiber. It has really good properties for it. In addition, there are other types of fibers that are available commercially that many people out there will be very familiar with. And these will be like methylcellulose, which is a semi-synthetic fiber, or polycarbonyl, which is a completely synthetic fiber. I won't go through brand names. There are lots of them out there. And I think if you go to any pharmacy, you'll see these 3 big types of fibers that are sold commercially. And then many people are familiar with other types of fibers, inulin or chia seeds and other type of fibers, which are probably less commonly used, but are also available. The three big ones I just spoke of that are commercially available.
Probiotics a good idea for somebody with IBS?
So the data, we're not sure. So the data is inconclusive to date. And the reason for that is that there are so many different types of probiotics. And what's sold commercially, there are many different combinations and making many different claims. So we don't know the specific strain, the quantity, and the duration that we're supposed to recommend patients to take it. So for that reason, we're a little hesitant to say, oh, you should to recommend a specific probiotic. But that's not to say that they're not helpful. There's plenty of studies showing individual fibers or probiotics or combinations can be helpful for people either with IBS with diarrhea or IBS with constipation. But it's hard for me to say, oh, this is the right one for a specific person. There just isn't that much data out there. We do suggest them for patients, though, because we do find people do find them helpful.
Who is most at risk for both IBS and IBD? Is it men, women, racial aspects to this, or no?
Yes, so for IBS and specifically, women tend to suffer from IBS much more so than men do. So particularly starting in their 20s to 30s, we see a rise in the prevalence of IBS. Again, women more so than men, particularly with IBS with constipation, which is even more predominant in women. There are other risk factors. So we see that many people report that they had a gastrointestinal infection. So it could be almost any type of inflammatory condition, including IBD, which I've already mentioned, but other things like just a gastroenteritis, a significant one. So people, if you had someone who was hospitalized or got very sick from a GI infection, many of these people develop IBS. The data suggests about 15% of people will have IBS, and they'll have persistent symptoms going up to, the studies have gone up to 10 plus years, showing that it's a higher rate than in the general public. Other inflammatory conditions, people that develop diverticulitis oftentimes will go on to develop IBS afterwards. It's the same process with IBD. The inflammation sensitizes the GI tract, can cause lingering symptoms. Other factors that people are at risk, people with having adverse childhood experiences, so people that have had trauma during childhood, they would be at a higher risk as well.
Wow, so it does affect mental health, and it's a whole body thing?
Yeah, it's the gut-brain axis that can be altered in a subset of people. So childhood experiences and people with PTSD at any age have a higher risk of it. It's good, again, emphasizing this gut-brain axis.
All right, the million-dollar question, can it be cured?
So it cannot be cured at date. Doesn't mean that everybody's going to experience symptoms forever, for their entire life. But it can be. But there are lots of treatments that can help reduce symptoms. So we mentioned diet and lifestyle factors, which we always emphasize in our patients. Beyond that, we oftentimes will resort to some treatments, those are medications. And there we initially start it's based on your bowel function. So people that, if you have more constipation, then we'll add a osmotic laxative. Is usually the first line agent. Also adding, if they have constipation, adding a fiber, like a soluble fiber. So that combination can help bowel function. Not necessarily abdominal pain or bloating, which are often significant problems for patients, but it can help with that. We'll also add an antispasmodic, so like something as natural as peppermint oil. Is a natural antispasmodic, so that could be something we would add that would help with the cramps for patients. So really starting with the basics, treatments that are widely available, over the counter, relatively inexpensive, can be helpful. That was for constipation. For diarrhea predominant people, well, again, the antispasmodics can be helpful, as well as the antidiarrheal, so loperamide, which is available over the counter, can be helpful. That'll slow down the GI tract for people that have diarrhea, reduce the urgency. Some people have fecal incontinence associated with urgency. That can help reduce that and firm up the stool. Again, not helping with the pain, that's where the antispasmodics would come in. Beyond that, if you're seeing your physician, and we would encourage you to see your physician, again, if the symptoms are persistent, are severe, or I'll emphasize again, if you have any of these alarm features like weight loss, blood in the stools, fevers, chills, or a family history of inflammatory bowel disease, colorectal cancer, you should see your physician to discuss these further. And then you would get a prescription. In those prescriptions, there are a number of different prescriptions that are available for constipation. There are 4 different prescriptions that are available, and 3 different ones that are available for IBS with diarrhea, so your physicians may help. And those prescriptions can be helpful because they can improve bowel function and those other abdominal symptoms, including the bloating and the pain associated with it. Sometimes we'll add like a low-dose tricyclic antidepressant or a neuromodulator, something that reduces those firing of the GI the nerve endings in the GI tract. It can be very helpful for patients with abdominal pain.
So what I'm hearing from you is hope. There is hope.
There's hope and there's treatments, and seek treatment, yes.
So,
don't suffer in silence.
Final thoughts to those who may be watching and thinking, oh my goodness, maybe this is what I have. What would you tell them?
I would tell them to talk to their physician. And make sure that you do the recommended workup and make sure that your physician thinks that you have the symptoms of IBS. And generally, we do some limited testing in individuals. It'll depend on their presentation, the duration, the severity, but some limited testing is appropriate for people. And those would include like a simple blood test. So if you have diarrhea, we would make sure you don't have celiac disease with a simple blood test. Make sure that you're able to absorb your nutrients appropriately, and that can be done with a blood test. And some limited stool studies may be appropriate depending on your travel history, etc.
All right, great insight, Dr. Lembo. Thank you so much.
Thank you, Monica.
Dr. Lembo talked a lot about fiber. Eating foods rich in fiber, one of the best ways to keep your digestive tract clean. Research shows only 7% of us get enough fiber in our diet, and we turn to our station in Minneapolis to see how we can fix that. Take a look.
We always hear that we need more fiber.
Yes.
Tell us why it's so important.
Well, it is sort of a cleaner in your gut in that it's, if you could envision a broom, that's fiber. So it's sweeping things through your gut. And if you don't have that fiber, stuff is sort of stalled. And when it's stalled, it then fosters all sorts of different problems. So fiber is a broom, if you will, but it's also really helpful for blood sugar control, blood cholesterol control. It feeds the good bacteria that's in your gut. So it's got multiple facets, but it really is something we're woefully short in.
And you said, what was it, 7% of Americans are the only ones that are getting enough fiber, right?
Yeah, so women need about 25 to 28 grams, and I know this means nothing until we get over to the food, and men need about 35 to 38 grams, and most of us get probably 10 to 12 grams.
And there's more than you can do than just have a shake, right, that has like some Metamucil in it. There are other foods that we can have that we can include in our diet. What can we have?
Yeah, and people will know me. I'm a food first person, so if you do Metamucil, that's one type of fiber. There's different types of fiber, so you really want to go to food because it's a whole package deal of fiber and nutrients that work in concert to do the good stuff in your body.
Well, show us what can we add to
so
our diet.
it's the usual cast of characters. So it's not like, oh, now I have to try something new. No, just keep going with the goods. It's fruits and vegetables, especially those with skins and seeds. Avocado, one avocado, 10 grams of fiber.
I would not
So
have known
you're
that.
a third of a way to perfection if you do that.
Have your guacamole, you're almost there.
Yes, yes. So whole grains are great, and people just think maybe of sorghum or quinoa or whatever, but popcorn's a whole grain.
Really?
So switch out potato chips for popcorn or tortilla chips, they're over there. Cereals, those are great. Beans are probably the most potent way to get fiber in. For one serving of beans, about 5 to 8 grams of fiber.
And you can buy beans in bulk dry, right? And then just soak them overnight and then...
Yeah, or do canned if that's going to take you back to, oh, I don't want to do it, it's going to be too much work. But one sort of fun fact is dark chocolate. If you go to 70 or 80% Dark chocolate, 2.5 grams of fiber for 1 ounce.
When you say
That's amazing to me.
To get fiber, I need to eat more chocolate.
I'm here to help.
Okay, so you have a delicious pineapple salad that you're going to help us make. What do we need to do here?
So we start with putting the dressing in the bowl, and it's a really simple salad. So we'll do 2 tablespoons of olive oil.
All right there.
And 2 tablespoons of a pineapple juice.
Pineapple juice right there.
And then we've got lime juice, a couple teaspoons of that.
Just a little bit, zest it up a bit.
Look at you go. And ginger. You can do fresh or powder in this if you need a spoon to...
You want to help me there?
Yep, shake it out.
I'm doing
And
the
then-
emulsion part of it right
Yes, it's a multi-group effort here. And then brown sugar, about a teaspoon of that.
now. Okay.
And
Good
then just
dressing right
mixing
there.
that up, getting that all swirled about.
Emulsify, getting it looking good.
You're doing great, but the brown sugar is holding me back. Honey would be a fine switch up.
Okay, any kind of sugar,
sweetener.
whatever, sweetener. Okay.
And then to it, we're just going to add these ingredients. So we've got pineapple, fresh pineapple.
All right.
And we've got edamame, so we've got our bean going in. Jicama. And you can drive in there or jump in there too if you want.
Jicama, this just looks like it's just diced up a little bit.
Yeah, sliced up jicama. That's red
peppers.
pepper. We've got our avocado, so we're getting a lot of good going there.
Okay, so avocado adds the fiber as well.
All of these things have the fiber
Really?
happening in it. Yep.
Okay.
Radishes, anything, fruit or vegetable is going to be a great thing.
Excellent.
And then cilantro. I hope everybody likes cilantro.
You guys like cilantro?
It's a divisive ingredient.
Extra cilantro?
I'm one of those soap
Oh,
guys.
it is.
I'm
Yeah,
one of those
some
soap guys.
10% of the population, I think, has
So
that
is
feeling.
this salad like colonoscopy prep, or like there's a lot of fiber
Well,
in here?
taste it. So 1 serving of it is 7 grams of fiber.
Oh, okay, so
it's
perfect.
pretty good.
Yeah.
But you could use this as a side dish for like a brunch if you have coming up with a quiche
It's
or
very different.
Easter dinner. And you could use it as a whole, a main meal if you wanted to put smoked salmon on it.
Add a little protein.
Yep.
Love it.
Cottage cheese, you could put chicken on it, so it goes all sorts of different directions. But
This is amazing.
fiber doesn't have to be roughage. Fiber is actually sort of pretty delicious.
It can be delicious. Awesome.
Remember, if you're experiencing any kind of stomach issue that persists for a long period of time, go see a healthcare professional. That'll do it for this edition of Prescription for Life. Join us next week for another dose. Until then, I'm Monica Robbins, wishing you and yours good health.
Thank you so much for tuning into Health Yeah. Please find me on Twitter and Instagram at Monica Robbins. Like and follow my Facebook page, Monica Robbins WKYC. Find video podcasts at Monica Robbins' channel on YouTube. And please subscribe. Wishing you great health and hope to see you again soon.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.